So what happens is, here you see this red line. This red line is basically your VCO2, and this blue line is basically your VO2. Okay, and you will see that this is the resting condition when the bed was not moving, or maybe if you are in the ergo cycle, maybe the paddle is, you are not paddling at all, just you're sitting and breathing nicely. Okay, so in that time what happens, because you are not in stress, so definitely you will get us almost normal straight line values here, and the moment we will give them a stress, so what will happen is, along with we are giving them stress means, then like normally boost protocol or whatever protocol, run protocol we use, if you increase the load, definitely your O2 uptake and CO2, the amount of CO2 which you exhale will also increase. Okay, so we'll see a nice form, and linearly, it will just go up and up and up if there is no disease, if they do not have the constant heart failure and all. So definitely if it is a normal subject, we'll see that it will form linearly, it will go. But there will be a certain point when we will see that these two graphs, now we see that this is parallel, okay, and it will be parallel up to some point. So there will be a moment when we will see that a certain high stress or load, these two lines will be intersecting each other's. So that is the point basically we call that respiratory exchange ratio is basically 1. Okay, so where the amount of oxygen what you take and the amount of CO2 what you exhale is same. Okay, so that we call RER. So during that RER, you have to see that what is your VO2. Okay, so in European countries and in American countries and even in India also, the studies and the people are now already started. Normally people are using this kind of modalities to do a good screening of the patients who are eligible for the transplant, lung transplant or kidney transplant or heart transplant, these kind of cases. So there are a lot of white papers and research papers, study papers, journals are there, which is proven that if your VO2 is more than 11 ml of O2 per kg body weight per minute, then your patient is risk-free. Maybe your patient is eligible for these kind of surgeries. If it is lesser than 11 ml, so definitely they should not go for the surgery. Okay, so there is a study for that. So this is something which we can find out from this test. Okay, so pre-operative risk. To find out pre-operative risk, cardiopulmonary test is one of the good modalities. Then not only pre-operative risk, post-operative also it works. That we call that rehabilitation. So after the surgery, then you have to, if you want to speed up the recovery of the patient, or if you want to understand the recovery, so then this is very good screening modality which can give you the exact idea, and training oriented, the work or load can be given to the patient every day, okay, just to see their improvement or to speed up their recovery with the proper diet and the medications. So again, same the VO2 level. Okay, so this is what something is very important, and secondly, it is very useful for to just do a single test, but gives you a lot of idea. Now there is a 9 panel, we call it washer band 9 panel, which gives you all idea. Like suppose one test you have done, and you will be able to understand whether the patient is having problem with the ventilation, the patient is having problem with the cardiac the cardiac part, cardiovascular limitation is there, or ventilatory limitation is there, or gas exchange limitation is there, or is there some problem in the cellular level or cellular respiration. So basically, if you see that there are 9 different plots are here, I'm not just detailing everything. So here, normally, as per the professor Cardiopulmonary, he said that the plot number 1, 4, 7, you have to look for the ventilatory limitations. Okay. Now suppose if the patients are very much the induced asthma or something like that, when there are very high stress, so then the asthmatic effects can be seen. So then these 1, 4, 7 is the plot which normally you have to look at You have to see different graphs. Why 147? You see what are the parameters, what are they doing. Here it is minute ventilation versus time, and also simultaneously it is with your blood pressure as well. Okay. So then here this is your 4. Again it is minute ventilation versus VCO2, and here 7 is your tidal volume versus your minute ventilation. So definitely all these graph, if it goes bad, so definitely you will understand that there is a problem with the ventilation. Okay. So then similarly we have different plots for the cardiovascular part. Let's suppose 2, 3, 4, 5. Basically 2, 3, 4, 5 is the plot for the cardiovascular diseases. Like suppose there are no ventilatory limitations, but there are some cardiovascular limitations. So why your 2, 3, 4 and 5, if you see, here you see this is directly related with the heart rate versus time and load, and O2 pulse. O2 pulse that is basically the value by which we understand that how good oxygen is going to the skeletal muscles. Okay, so then here the second is VO2 versus time as well as load. Then this one is again minute ventilation versus VCO2, and here it is heart rate versus VO2. So if there is any your cardiovascular limitations, so evidently these plots will be affected and will have a compromised, the values of the dots, basically the plots. And then this 6 and 7 is basically for gas exchange. Now one test, there is no ventilatory limitations, there is no cardiovascular limitations, but you could see that there is a problem with the gaseous transport. So then if you see problem with these two, the next test to correlate is this one. So then this can be correlated with the DLCO test. That what would be the reason. Okay. So similarly, this plot 8 is to understand the metabolic part, the internal cellular respiration. Okay. So in this way, it has to be interpreted. But nowadays, the user is free to customize their own 9 panel. So if I want 147 in this way, 147, so I can place it right here. So it's just a combination. And then the most important thing is here, the ventilatory thresholds. So the graph is not very nice because I have not continued for a longer time. Otherwise, you could have seen that it is actually intersecting each other, and that cross point is your RER1. So basically, RER1 should be considered for the healthy subjects. Those, especially for sports medicine, the people, those who are, going to participate in some kind of, or to go for the, they want to give the performance, consistent performance, maybe athletes, maybe cricketers, maybe footballers, maybe cyclists. Okay, so for them, we will judge the VO2 at RER. But for the patients, it has been told that it should not be RER, because for the patients, those who are having congestive heart failure and all these things, probably at 80%, their fat and their protein and everything comes under the combustion stage. So that point we can find out here. You see that 18, just a small thing. We are free to choose. If I see that there is a healthy subject, I will judge the patient with the RER. If it is not a patient, if it is a patient, then definitely I'll go with the AT, that is your anaerobic threshold basically, with the P slope. Okay, so when it is intercrossing with each other, the point where it is meeting each other and the point where it is leaving each other, that the isolated line or plateau is being recognized as RER1, or the starting point of the anaerobic threshold, or ending of the aerobic threshold point basically. After that, we will experience that, we will see that the CO2, amount of CO2 is very high rather than the O2 uptake. Obviously, because now the patient has entered into the anaerobic phase, and because of that, it will create a lot of lactate, and as a result, it will create additional CO2 and water. So that CO2 basically patient is exhaling, because of that the CO2 amount is very high. And then there will be a certain point when there will be a second ventilatory threshold, which is known as respiratory compensation point. Okay, maybe after that patient cannot take the stress. Maybe they are too much fatigue, they cannot do, or they cannot run on the treadmill. So how to understand that whether that is his limit or not? So then we have to take a sample, blood sample. Okay, and we have to see the amount of lactate in the blood that we have to put into the software. Okay, so then here I have the second ventilatory threshold and different judgments. I can judge the respiratory compensation point with the equivalent CO2. I can judge with the equivalent CO2 by time. I can judge it with the mini ventilation divided by time. I can judge with the PET by time. So a lot of different parameter to judge. This is the breath by breath data, and here the whole test. Here we see the time, and here we will see the maximum VO2. So here this VO2 per kg per minute. This is the column which is important for us to see that what is the maximum value which patient has attained. Okay. And then we have this blood gas area where I can put different values for my patient, like what is the marker, the time I have to enter. Sorry, maybe 1 minute. And then if I add, then it gives me an option to enter the amount of, just like the hemoglobin option. Here also it will be same. It will give you scope to enter the amount of lactate what you have got from the blood test.